There's so much focus and discussion on obstructive sleep apnea in the dental world, medical world, and in the media here or there because it is full-blown disease with significant comorbidities such as heart disease, heart attack, stroke, metabolic syndrome, Alzheimer's disease, and more. You have one foot in the grave with a diagnosis of sleep apnea. The focus has also likely been about sleep apnea because that is what is recognized by medicine as disease, and that is the standard set by medical insurance for you to be treated and get awarded with a breathing machine or an appliance that tries to prevent your tongue from choking you. Sleep apnea is also the main disease that a sleep study is looking for. If you don't meet the criteria for sleep apnea, where you stop breathing for a minimum of 5 times per hour, conventional medicine and dentistry don't have a treatment for you. So until your condition progresses to full-blown sleep apnea, you're stuck between a rock and a hard place. Our healthcare system is failing us. But there is a disease state that is significantly more common, greatly underdiagnosed, and generally emotionally and physically more debilitating than sleep apnea, called upper airway resistance, UAR, and upper airway resistance syndrome, UARS. The etiology is the same as sleep apnea. The tissues of the throat, the soft palate and tongue start to narrow the airway. But with the UAR, the brain and nervous system respond very quickly to this threat. The brain is being hypervigilant to protect you, but your sleep pays a price. I'm going to talk more about the differences between sleep apnea, upper airway resistance, and UARS in just a little bit. But before I do, take a look at this continuum that I've created. It shows the increasing severity and health risks associated with breathing disordered sleep as it progresses. On the far left of the continuum is healthy, invisible nasal breathing, which carries no symptoms or risk. The key is the nose and the ability to breathe effortlessly through it all the time. Sleep is hallmarked with nasal breathing, is invisible to the ears and eyes. The body is in a parasympathetic state, resting, digesting, restoring, rejuvenating. The brain is getting cleaned and you're truly sleeping. On the far right side of the continuum is sleep apnea, which carries many debilitating symptoms and extreme health risks. Just on the other side of sleep apnea is literally death. As we populate the continuum from left to right, you can see breathing disordered sleep has different presentations. There's audible breathing, mouth breathing, snoring, then upper airway resistance, upper airway resistance syndrome, mild sleep apnea, moderate sleep apnea, and finally severe sleep apnea, which will be fatal if untreated. You do not necessarily progress from one to the next until you get to the UAR-UARS stage. From there, it will progress to sleep apnea if not treated. It's not a matter of if, but when. With females, it can be during pregnancy or after, or around the time of menopause. In males and females, it is a matter of time and or weight gain. It's sometimes helpful to think of upper airway resistance as sleep apnea's little sister. It's caused by the same anatomical problems, but the body's response to the threat is different. What is the difference between sleep apnea and upper airway resistance and syndrome? With both, there's a restrictive turbulent nasal airflow or turbulent airflow from mouth breathing. If you're using your nose and the airflow is turbulent, there's 6 points along the nose, nasal airway, and throat, which can cause more turbulence and eventually enough pressure to close, collapse, and choke your airway. These 6 points are the nostrils, nasal capsule, which includes the septum and turbinates, the adenoids, soft palate, the tongue, and potentially enlarged tonsils. There are pressure receptors throughout the airway that are there to detect changes in airflow and protect us from these potential threats to breathing. The problem is that this protection comes with a price, which is sleep fragmentation, which are mini awakenings that can happen many times per hour. The worst I've seen is 55 times per hour. Upper air resistance patients do not stop breathing or desaturate long enough to be apneic. These mini awakenings show up as arousals on a sleep test, but their significance is often overlooked, thus a negative result on a sleep study. Upper airway resistance is the person with many nervous system arousals. Upper airway resistance syndrome is the same sleep profile, but the patient is symptomatic. The same scenario happens with sleep apnea, except the body's response is different. With sleep apnea, your tongue is choking you for at least 10 seconds or more, and your oxygen levels drop by at least 3%. Your heart and brain are being depleted of oxygen for greater periods of time. You don't suddenly develop sleep apnea, it's a progression. You do not have healthy sleep one day and sleep apnea the next. Interestingly, your nervous system's hypervigilance has worked so hard for so long that it finally gives up. Now the primitive brain, that which is responsible for survival, kicks in to save your life and make you breathe. Interesting, don't you think? Why do we have to wait to make changes? What type of symptoms do UARS patients present with? We have daytime fatigue, insomnia, being a light sleeper, you don't like to sleep on your back, you suffer from frequent headaches, migraines, TMJ problems, depression, anxiety, cold hands, and low blood pressure, to name a few. How many people do you know that have some of the above symptoms? At AirSync, we have the treatments to help you get healthy again. Remember, when it comes to breathing-related sleep disorders, loud breathing during sleep and snoring are never normal. There are always signs of an existing or developing health problem, and children who snore or breathe loudly at night will not outgrow it. 99 times out of 10, the condition will progress and worsen over time. Finally, there's some good news. Sleep apnea and upper airway resistance syndrome can be managed and, in many cases, reversed, especially when it comes to children. And the earlier breathing-related sleep disorders are diagnosed, the better the chance of a positive outcome. If you want to improve your health span, AirSync is the place to go. So if you suspect you or a loved one may have a problem, please make an appointment sooner rather than later.